Hello, my name is Lauren Carnes, and I'll be discussing the pathophysiology of hypovolemic shock. The disease process of hypovolemic shock can be potentially life-threatening and a dangerous condition. When we think of the word hypovolemic, a good way to remember and identify this easily is hypo, which means low, which means volume, and emic, which means within the blood. It occurs when there's low fluid volume in the intravascular system. This is also related to 20% loss of total volume of intravascular blood, plasma, or fluids. And like I said, disrupts the circulatory function in the body. This could potentially lead to tissue failure and potential organ failure. This could be related to trauma related to blood loss or non-traumatic blood loss. The pathophysiology, when loss of fluid from the intravascular spaces occur, the heart is not receiving adequate venous return. So basically, the intravascular system is the space that contains the volume of blood in a person's circulatory system. Therefore, there's a decrease in the volume of blood in the person's circulatory system. And what happens is the heart is really not having enough to pump, hardly anything at all. So this causes, having the reduced venous return causes a reduction in ventricular filling. This causes a drop in the stroke volume. Then the cardiac output falls, resulting in a reduced perfusion to the body's organs and tissues. Due to this shift in cellular metabolism, it'll go from aerobic to anaerobic. Metabolic acidosis occurs due to the accumulation of the lactic acid that occurred in the cellular shift. And like I mentioned above, major fluid loss will result in organ failure. So just circling back, if the amount of blood in the heart pumps to the organs and tissues decreases, then the cardiac output decreases. This is where it leads to the decreased tissue perfusion, which will alter the functions of our cells. It will also limit the access to oxygen. And that's when you'll see the signs and symptoms of shock. Some risk, I also want to talk about, there's 4 different classes, as you can see, of hypovolemic shock. There's class 1. You can see it's 0 to 15%. That's when you'll notice blood pressure and breathing. It still may be normal, but there's a lot of early signs and symptoms that get overlooked because you're missing those early signs and symptoms, which I'll discuss below. A person may suddenly feel anxious and irritable. Skin will become pale. Class 2, as you can see, it's a loss of 15 to 30%. 750 to 1500 mLs. That's when you'll see some heart rate changes. The breathing will get faster. And then class 3 will be the blood loss from 30 to 40%. That's when you're going to see your major drop in your blood pressure. And that's when the changes in mental status will occur. And then class 4, that's a critical situation. The pulse pressure is really low and the heart will beat more. Some risk factors, I won't go through all of them, but you can see below. Also with PD patients, one of the bigger risk factors too will be severe burn for a PD patient as well. You'll see dehydration, heat stroke, trauma. I also want to mention ectopic pregnancy. You'll see placenta previa, ETOH use. Older adults tend to be more at risk, and this is related to them being more susceptible to dehydration and pre-existing conditions involving organ damage that's already there. Individuals having disorders or conditions that reduce circulating blood volume will also be more at risk. I won't go through all the major signs and symptoms that are here. However, I do want to point out, like I mentioned above, that some of those early signs often get missed. The sudden irritability and anxiety that are a good physical finding in the beginning. So the physical findings are based on a degree of fluid or blood loss, but I want to note that there is some early signs here, and then changes in signs and symptoms occur when the blood pressure really plummets and the blood flow really decreases. So that's when you're going to see kind of a shift in these signs and symptoms. So some early signs, like I mentioned, would include the orthostatic you would check with the orthostatic vital signs and a tilt test. In early signs related to that sympathetic nervous system response to hypotension is thirst and agitation. There are early signs, like I mentioned, that would be missed, and direct characteristics would include pale, cool, clammy skin, the tachycardia, hyperventilation, which you'll see below with the shift in signs and symptoms, where the blood pressure decreases. You'll see lethargy, weakness, dizziness, more of those rapid but shallow respirations. And this is where you'll see the respiratory alkalosis. The urine output will be decreased. And then here you'll see more of a irregular thready pulse. So you'll see a change in the pulse from more of the acute beginning stages. You'll see the mental status changes. And then again, as noted above, the metabolic acidosis occurs in the progression of the hypovolemic shock. You'll see some of the diagnostic testings here, CBC, ABGs, electrolyte levels. I do want to mention, which is very important when you think in an acute situation where maybe there's a trauma involved, and there's a lot of fluids being lost. The ABO typing and cross matching is very important, because if they're getting a blood transfusion, you need to know that quick. And imaging for identification of internal bleeding. There's chest and abdominal x-rays, x-ray if bones are broken in a trauma. Some diagnostic procedures would include gastroscopy to identify any bleeding in the stomach, in the esophagus. You want to also be able to monitor the cardiac output. Emergency treatment is very important to know for shock. You want to place a patient in a supine position. You want to cover and keep them warm, and obviously call for assistance and administer O2 if applicable. Thank you very much, and I hope you enjoyed.